It is Wellness Wednesday, and today we are talking with Dr. Sasha Spencley, a general surgeon at Memorial Healthcare Surgical Associates, who is here to talk about hiatal hernias, GERD, and minimally invasive robotic surgery options. Good morning.
Good morning. Thanks for having me.
Yeah, thanks for taking the time to come in. So, first off, explain to our viewers, what is a hiatal hernia?
Yeah, a hiatal hernia is an enlarged hole in the diaphragm that allows the stomach or other intra-abdominal contents to come up into the chest. There are many causes. It can be caused by trauma, you can be born with it, or anything that increases your intra-abdominal pressure, such as obesity, chronic cough, constipation, or heavy lifting.
Okay, so you deal with all sorts of cases here. So what are some of the causes and those symptoms? What should we be looking for with a hiatal hernia?
Yeah,
you mentioned them.
The symptoms of hiatal hernia, there are typical symptoms such as GERD or gastroesophageal reflux disease, heartburn, regurgitation, or trouble swallowing. There are also atypical symptoms or less common symptoms such as shortness of breath, cough, asthma, or hoarseness. And you can also have more serious symptoms such as bleeding, ulcerations, twisting of the stomach in the chest, which can be a surgical emergency, or Barrett's esophagitis.
Okay, so a lot of things to be looking out there for. What is the connection then between a hiatal hernia and GERD?
There is a strong connection between hiatal hernias and GERD because when you have a hiatal hernia, you lose function of that lower esophageal sphincter or valve that prevents acid coming up into the esophagus. So actually 50 to 90% of patients with a GERD actually have a hiatal hernia.
Oh goodness. So, with all that considered, where do you come in? What are some of these treatment options available?
Yeah, so the symptoms of a hiatal hernia, the mainstay is medical management. So smoking cessation, weight loss, dietary modifications, avoiding like spicy foods or tomato-based sauces, elevating the head of the bed when you sleep, not eating up to 3 hours prior to going to bed, or acid-reducing medications. Where I come in is when that hernia is too big, or patients wish to avoid lifelong medications, or their symptoms are just not well controlled on the medical management side. So then surgical repair of the hernia is the treatment.
Yeah, so you are a surgeon. Talk about why you're so passionate about helping people get better.
So I think GERD can really affect people's daily lives. Like if you have reflux, you have to alter the foods you eat, the situations you're in. It really impacts people's social ability, social calendar, stuff like that. So I think it's a really good option for patients just to live a healthier, better life to fix these hernias.
Yeah, it can have an impact on your everyday life.
Yeah.
And then we mentioned, minimally invasive robotic surgery. Talk about the advancements that have come along with technology and being able to perform these surgeries.
Sure. So a hiatal hernia used to be fixed through a big incision on the abdomen, a lot of morbidity associated with that, hernias, pain, chronic pain. So now we're able to fix it through small holes, just 5 small holes that we can do it with on the robot.
Wow.
Less pain, less complications, less, earlier return to work and daily activities.
Yeah, so what's the recovery like for that? It sounds like it's not too bad.
No, it's pretty quick. Typically, people stay in the hospital overnight for 1 day and then they go home the next day. And it's no heavy lifting for over 10 pounds for about 6 weeks, but otherwise no real restrictions.
Wow. I mean, again, you can set people on the right track there and get them back to their normal lives quickly. Yeah. Thank you so much for that information and taking the time to come on today. And for more information about hernia surgical options at Memorial Healthcare, you can visit memorialhealthcare.org, or you can call the number 989-723-3168.